Modifiers are an important part of coding and reimbursement or billing for healthcare services. And they provide insurance plans when you're billing with your CPT code, additional details, and 2 or more modifiers may be assigned to one CPT code. One of the top billing errors determined by federal, state, and private payers involves incorrect use of modifiers. So it's very important that coders understand and apply modifiers correctly. There are 2 levels of modifiers. Level 1 is a 2 numeric digits, so like 59, 22, 25. It's updated annually by the AMA. Level 2 is 2-digit modifiers, so they start with alpha, like AA through VP. So those could be like your LT for left, RT for right modifiers, and that's updated annually by CMS. So here's just a description I put in here so you could see the modifier, the description of the modifier, and in the code book, the CPT code book, and your textbook, you have full descriptions of exactly how these modifiers are used. But here I wanted to show you also the reimbursement impact that these modifiers have. So why it is so important that we get these correct. Modifier 22 is when documentation supports substantial additional work. The procedure maybe is more complicated or complex, and again, this would have to be documented by the physician. Maybe the physician had an increased work effort by 30 or 50%. An example of this would be lysis of adhesions. So the physician documented maybe an additional 90 minutes spent lysing adhesions. That could warrant modifier 22 as long as the documentation supports that, and the physician did state that. When modifier 22 is billed, the op report should be submitted with the claim to justify and show that additional increased work effort. Now, the overuse of this modifier can send up a red flag and trigger an audit. Modifier 25, you'll see those on the E&M codes. When a service is provided by the same physician on the same day of a procedure. 25 can be appended to the E&M code along with the surgical procedure code. And modifier 50, bilateral procedure, is the same operative session for procedures performed on identical anatomic sites. It's not applicable when the CPT procedure description is bilateral by definition. And if a physician was removing, say, a lesion from a right and left arm, it would be more appropriate to use the modifiers RT and LT, so code that twice with modifier RT and LT instead of coding the code once with a 50 modifier. Modifier 59. Modifier 59 identifies procedures or services not usually reported together, but under certain circumstances, it can be added to a procedure code. Of course, this is not appended to an E&M code. There is a big flag for inappropriate use, as modifier 59 is often used incorrectly, and there's actually a lot of audits around modifier 59. From an NCCI perspective, the definition of different anatomical sites includes different organs or lesions in the same organ. So documentation must really support that these procedures are distinct from each other. An example, patient has a chondroplasty during the same surgical session as a meniscal repair on the same knee. The chondroplasty must be performed in a different compartment than the meniscal repair. If not, then only that meniscal repair can be coded and not the chondroplasty. If that chondroplasty was in a different compartment, then the chondroplasty can be coded with the 59 modifier. In a few slides, we're going to discuss the new CMS directive for modifier 59 that will be in effect January 1st, 2015.